My name is Stephen Biss. I'm a lawyer in Mississauga, Ontario, Canada. I'm also a qualified Intoxilyzer breath alcohol technician, and I've taken the Data Master Supervisor's course. The evidentiary breath testing instrument that we use in Ontario is the Intoxilyzer 5000C. The Intoxilyzer 5000C is an Intoxilyzer 5064 series instrument like this one. One of the difficulties with these old instruments, which are 3 generations of instrument behind state-of-the-art, is that they sometimes misidentify other molecules other than ethanol, thinking that they are ethanol. There are things such as acetone on the breath of diabetics, or isopropanol on the breath of diabetics, various things like hand cleaners, limonene and d-limonene, and also something like Ventolin, which mimic ethanol. The question is, does the instrument identify those as an interferent, as something other than ethanol, or do they identify them as ethanol? We're going to run an experiment now to see whether or not Ventolin has any kind of an impact on the calibration of an instrument. Like all infrared testing machines for breath, the instrument needs to reset 0 with every air blank. This instrument right now is sucking in room air and is checking the room air and is looking in the room air for ethanol or other interferents and is adjusting 0 for that purpose. It's now running a calibration check using a simulator at 100 milligrams per 100 mils. This simulator is indicating that this instrument right now is performing within specifications. The instrument is treating the 100 milligrams per 100 mils as being the equivalent of about 96 milligrams per 100 mils. That's well within specifications. The instrument is good to go. But what happens during the air blank if some Ventolin gets into the breath tube? Or some other kind of interferent? What impact does that have on the instrument? We're going to find out. Because if Ventolin is having some kind of impact on the instrument, then we're going to see a calibration check that is different from what we saw before. And sure enough, we're now seeing the calibration check in the low 90s or the high 80s. And so what's happened is that this instrument has been affected by the Ventolin because the instrument thought that the Ventolin was ethanol. And so we get a calibration check of 90 rather than what we got before. The purpose of this experiment was to explore the question of whether or not Ventolin has an impact on the calibration of an instrument. In the same way that it had an impact on the calibration of the instrument by adjusting 0, it's also possible that Ventolin could have an effect on a person's breath when they're blowing into the instrument, and the instrument might identify what is seen by the instrument in a subject test as being ethanol, when in fact it's a combination of ethanol and Ventolin. This experiment shows that interferents are a problem with the Intoxilyzer 5064 series. You need a lawyer who understands how these instruments work. Don't plead guilty on your own. You can phone me, Stephen Biss, at 905-273-3322 or 1-877-273-3322.